My first guest is Amy Stern, Executive Director of Hospice of Rockland. Welcome, Amy.
Thank you.
So, Amy, Hospice of Rockland has really been a staple here within Clarkstown and within our community for very many years. And you really do God's work, just incredible work over there with people at the end of their lives and their families. And you have an awful lot of programs. Maybe you could, just for the benefit of our viewers, talk a little bit about Hospice of Rockland, how long it's been here in Rockland County, and what your basic mission is.
This next January, we're going to be celebrating our 30th anniversary. I don't know where all the time went. I've been there the entire 30 years. I started as the program's first social worker, so underneath the CEO still lies a social worker. At the beginning, for many years, people thought of hospice as just our community-based hospice program, taking care of people nearing the end of life in their own homes or the homes of their loved ones. But thanks to the support of the community, and especially everyone in Clarkstown, next month we'll be celebrating the 5th anniversary of the Joe Rasso Hospice Residence, which is really a very, very special place. It's a home-like environment for those individuals who can't be at home. We always hope to be able to keep people at home, but there are so many reasons why that's not possible. And although there have been other places people could be cared for, we really didn't feel it was the right setting, so we created the Joe Rasso Residence. In addition to providing care in people's own homes, we provide care in 8 of the 9 nursing homes in Rockland County. We provide care at both of the acute care hospitals. And we also provide care at assisted living facilities. And some of our most gratifying work is at group homes with the developmentally disabled who face end-of-life issues.
Right. And so how does somebody qualify for hospice level of care? Like, what's the trigger that somebody would end up coming to you, or you would be engaging with the family?
Well, the legal criteria is that if a disease follows its normal course, that the physician, along with our medical director, would believe that the individual has a life expectancy of 6 months or less. It's really a gift to us and to patients and families when we do have the opportunity to care for people for months, but far too often we care for people for literally hours or days, and if we're really lucky, then a couple of weeks. So that sometimes we feel that we don't just care for people at the end of life, but really for people at the brink of death. Right. And people say to us, far too often family members say, I wish I had known about hospice sooner, or that I understood what hospice was or wasn't sooner, so I and my loved one could have benefited from hospice services. There's so many myths related to hospice care. People believe that you do have to be days away from death. People do believe that you can't have any hope when you're a hospice care. It sort of becomes a self-fulfilling prophecy that death happens soon. Not because hospice did anything to hasten death, but because people waited so long, so close to death, before contacting us. We feel it's a huge disservice because that we are able to control symptoms earlier, that we're able to provide support for patients and families earlier, help people to cope, work with, people just think of hospice for older people, and most of our patients are in fact older, but we care for many middle-aged and people with children. We even take care of a few children over the course of the year. I think right now we have a 14-year-old on the program. We've had a 16-year-old this year on the program. Of course, that's always a tragedy. Right. It's really important to try and keep children at home whenever we can. So that, and the other piece of hospice people forget about is the bereavement services that we offer. Not just for individuals who've had a loved one on hospice, but for anyone who's had a loss in the community. We offer the only children's bereavement program. Right now we have 75 people enrolled in our children's bereavement program, meaning children and a surviving adult. If you came on Wednesday evenings to our offices, you'd think we had a school going on there with all of the kids there. So bereavement is a big part of what we do. We also offer, which is something most people are not familiar with, assuringyourwishes.org, which is a free, online, secure way people can store and retrieve their advanced directives. Advanced directives being things like healthcare proxies, living wills. Carrying paper around is impractical. Thinking that they're not going to get misplaced in healthcare institutions is unrealistic. So because of a personal experience that I had, we developed this. It's a free service. We have a website, www.assuringyourwishes.org, that has a ton of information and the forms. And we have thousands now of those directives stored, and hope to have many more thousands stored so that there's some place that's available when individuals and their healthcare providers need those directives.
So how did you, how did you get into this line of work with hospice? I can tell you, it's an unusual and very challenging, and I have a little personal experience with it. I've had family members that have accessed services. My grandmother, about 15 years ago, and the end of her life was made so much better, and our family was touched by the generosity and the work of hospice. When I was in the seminary, one of my pastoral assignments was for a year. I spent some time up at Rosary Hill over in Hawthorne, which is a similar type, concept, end of life type care. And I've had some experience with Calvary Hospital before, hospice as well. And it's a challenging and unique area of service. How did you decide to get in working with hospice, and what makes you stay with it?
It wasn't that I said I'm going to make a conscious choice to go to hospice. I decided to go to social work school, and as a result of some of the placements that I had in social work school, I thought that healthcare might be an area. And I grew up with a brother who was diabetic when he was 2. He became diabetic. He eventually died as a 34-year-old young man. I had a chronically ill grandmother with congestive heart failure. I was comfortable around illness. And when I worked in healthcare and I saw the way the dying were cared for, I just felt that there needed to be another way to do it. I wound up eventually at Good Sam in the precursor to what became the hospice program. You have to be licensed in New York State to operate a hospice. You can't just hang up a shingle and call yourself a hospice. So I really did enjoy the clinical work because I felt that even though it was sad, it wasn't depressing. We were privileged to walk into the lives of other people at a very challenging time. But we watched most families give their loved ones the last gift that they could give them, which was to care for them at the end of life. And we just made it possible for them to do that. So that every day, I think, people say, how does your staff do that? It must be so hard. I think every day they know they make a difference in someone's life. They're able to walk away each day feeling gratified. Of course, people have the normal frustrations that go along with paperwork and the rest of those things. But every day we receive in the office a poignant letter. And we have an interaction with a family. And it's just the personal sense of gratification that hospice work brings us, I think, which is why all of us stay in hospice.
Yeah, again, as I started off the our interview, hospice is really just such a unique and important staple within our community, and the care that you have provided to literally thousands, tens of thousands of people, these past 30 years, absolutely incredible. And there's probably not a person that's watching that will watch this on our television station that will not have had an experience with hospice. I think most people have had some type of experience, unfortunately, because of some of the horrible illnesses that people suffer from. In the moment we have left, maybe you could talk a little bit about how people can help hospice. What are some of the ways in which upcoming events, fundraisers, and certainly hospice is a not-for-profit entity which struggles with budgets. So how can people help hospice?
Well, one of the first ways has nothing to do with money. We are the only healthcare entity that is mandated to demonstrate a 5% cost savings through the utilization of volunteers. So we are fortunate to have several hundred volunteers and could always use more. We have volunteers that work directly with patients and families, and they go through a very specialized training. Some do it in the home, some do it at the Joe Rasso residence. We have volunteers that do help with fundraising events. We have volunteers that work in the office. We have a great group of about 60 teenagers each year who comprise Youth for Hospice, who have decided that the way they're going to receive community service credits is by volunteering for United Hospice of Rockland. Throughout that process, they learn about hospice. They meet once a month at the hospice offices. We have chapters in almost all of the high schools. So we're also looking for teenage volunteers. Obviously, as one of the many not-for-profits in Rockland, we always do appreciate donations made. People make memorial donations. We have a legacy society for people who'd like to make a planned gift. Without the generosity of the community, it would have been impossible to have built the Joe Rasso residence and for us to continue to provide our services. So we feel grateful to anyone who chooses to do that.
Great. And how can people get in contact, website?
We have a very comprehensive website. You can communicate with us through our website, hospiceofrockland.org. Our phone number, 634-4974. We're just a phone call away to anyone who may need our services, in addition to being having an interest in getting involved with the organization.
Well, Amy, again, thank you for being such a wonderful guest, and more importantly, thank you for your service to our community, not just the community here in Clarkston, but the community of Rockland. Your service these very many years at hospice, and thank you for all that hospice does.
Thank you.
Coming up next, Korean War veteran Jim Finn.